This is Sonia Liebendorfer. I am going to be talking to you about pharmacology today. We are going to go through it in a methodical approach to try to gain a better understanding of how different medicines influence the systems of the body and how the body uses those medicines to help it overcome certain illnesses and diseases. Okay, today we're going to talk about acid controllers for the stomach. Because a lot of times when you have an emergency and you have chest pain and you're in the ER, they usually give something to try to differentiate whether the pain is coming from the stomach or whether the pain is coming from the heart. And it's difficult for them to tell sometimes because the same nerve innervates the stomach that innervates the heart. So they have to kind of do a test to see which one it is that's really the problem. So when you're in the emergency room, a lot of times they'll be given what they call a GI cocktail, which if it's something stomach related, that immediately gives the calming effect because it has a numbing medicine in it and it'll calm everything down, and the chest pain, so-called chest pain, will subside if it's something related to the stomach. So on this page, I want to go over the 4 different types of medicines: antacids, cimetidine, famotidine, and omeprazole. Now, I'm not covering these medications in length because the main thing that you need to know about these medications is you have to be very careful when giving them around food because a lot of them interact with a lot of medications, be it for heart, be it for um, the gut, all kinds of medications. So in thyroid medications, you have to be very careful with these drugs that control acid because you have to normally take them either 2 hours before or 2 hours after any other medicines. And that's because there's so much of a problem with interaction. It can cause heart arrhythmias. It can really mess people up. So you have to be careful with these medications and just keep that in mind because, for example, my father had to take something for acid reflux. He had it badly, but he always had to make sure that he took his thyroid medicine first. He would take that first thing in the day. And then a couple of hours later, he would take his acid medicine. And then a couple hours of after that, he would eat something. So you have to develop a schedule around some of these medications when you're giving them, and that's important for you to know. You also need to know that there are a lot of foods that trigger acid secretion. So even though they're on these medicines, if they don't eliminate some of the acid in their diet, they're still going to have a problem. So some of the foods that can trigger increased acid production in the stomach are caffeine, chocolate, alcohol. Make sure you use alcohol in moderation if you're having problems with heartburn and acid reflux. So another thing we need to talk about is emotional stress because that in and of itself can trigger more acid production. And it can give you this burning pain in your stomach due to the increased production of acid. Now, famotidine is used a lot in the ICU setting. When it's used in the ICU setting, they will give it 12 hours apart. Usually it's scheduled for 9 in the morning and 9 at night, and they'll give it IV. And here's why. When a person is in ICU, and particularly when they're on life support, it is very important to keep the stress ulcer problem from not being able to eat and yet having the constant irritant of that acid in the stomach at a limited basis. Because whenever they're in ICU and they're unconscious, they'll either be feeding them through a tube in their nose or they'll be feeding them in a tube through their stomach, or they'll be feeding them TPN, which is um, basically IV food through a central line, or PPN, which is food through a peripheral line, such as a PIC line or a Groton. But I want you to be aware of why they do the, the stress ulcer prophylaxis, because it is very important to help keep those acid levels down. And another reason that it's so important when you have somebody that's unconscious and they're on feedings, that you check their stomach, check their residuals when they have tube feedings to make sure that it's being digested. Because if that stomach slows down enough that all that stuff is just cooling there and it's not moving on through, then we have a problem. And we have to help them to start to move that food through. And I think erythromycin has fallen out of favor through the years because it interacts with so many other medications. But we used to give liquid erythromycin down the tube along with the tube feed because it promotes that rhythmic movement, what they call peristalsis of the gut, and it helps to be able to digest the food. Okay, now here are four more drugs that are used to control acid: ranitidine, pantoprazole, simethicone, and sulcrophate. Now, the last two normally you will see prescribed by a doctor because they are more in a fluid form to kind of coat the stomach, whereas the others are pretty much just in pill form. But some of the things are over the counter. The Malox, the milk of magnesia, the um, Pepto Bismol, things of that sort. You can get over the counter, but other medications, they require a prescription for them. So if you can, what they normally do is they start you out on one of these medications by pill, and they tell you to take it for 6 weeks to see if you have an improvement in symptoms. If you do not have an improvement in symptoms and you are still having increased acid to the point that it's backing up in your throat when you try to sleep and you wake up with that terrible burning sensation in your throat, if you're still having that after 6 weeks of being on these medications, they normally want to do a scope going down to your stomach to determine to make sure you don't have any kind of ulcers in your stomach. They might want to do a barium swallow to make sure that you don't have any problems, any difficulty with a hiatal hernia. So it is important that you take these medications as they are supposed to be taken. Like we said, it's important. It interacts with a lot of medicines, so you have to take it 2 hours before or 2 hours after other medications, and that also goes with food a lot of the time. Also, you have a lot of foods that trigger acid. There's caffeine, chocolate, and alcohol on here because alcohol triggers it a lot. So you make sure you are using that in moderation. But another thing that triggers it a lot are tomatoey sauces or tomatoey based um, tomatoey based products. And sodas, anything that's got citric acid. If you read your label on stuff that you're drinking, such as Sprite, um, such as lemonade, anything that you look on that bottle and you read that list of ingredients and it says citric acid, you're increasing your acid production when you drink that just by drinking it. So all of the stuff that tastes good, you basically can't have because it'll increase your acid production. Especially be careful of sodas, be careful of coffees and teas, and make sure that you really watch really rich flavored sauces such as spicy foods and tomatoey-based foods because it can really make things worse. And also remember that emotional stress itself can trigger more acid production. That's all that I'm going to go over on gastric reflux. There's not really anything on it as far as nursing boards that you need to be concerned about. What you do need to do is if you see one of these medications on a patient's MAR, make sure you look up that medication and you see whether it has to be given 2 hours before or 2 hours after somebody eats, exactly when the administration for that particular drug is supposed to be. We have so much material to go over that I am not going to do a quiz on this part, just like I did not do a quiz for the previous part. But it is so important that you keep track of your patient's medications and when this needs to be given, especially if they're on a medication to help a heart rhythm, such as diltiazem or Pacerone or any of those drugs, because this these type drugs affect their ability to work. So, and they affect the ability of the heart to beat properly because they are a rate controller if they're on a beta blocker. So you have to be careful. And I can't emphasize that enough. So before you start giving somebody one of these medications, make sure you look it up at your drug book. Make sure you see what it interacts with. Make sure you see what the time spread is with this medication. Is it 2 hours before they eat or is it 2 hours after they eat? Because they're all different. And make sure that you always check your patient and see what they're on as far as cardiac drugs, because that is the main ones that these really interfere with. That's it, guys. One last section to go, and that is a huge section on antibiotics. We're almost there. Yay! It's okay, you can celebrate. I'm right there with you.